Hey folks, so today I wanted to talk a little bit about affirmative therapy. And affirmative therapy is really basically a therapeutic approach that affirms and validates the wide range and continuum of human sexuality, gender identity, and sexual orientation. It really was developed because there is an acknowledgement that we don't just fall into binary categories of gender, and that there is a huge range of identities and relationships that maybe fall outside of what most folks understand, and is viewed as normal, for lack of a better term, that really are actually very normal and have been around for a very long time. And that I don't think that we've done a really great job in the mental health field of affirming and validating and saying, yes, this is okay, this is not unhealthy, it's just maybe a little bit more unusual. And really, I got into this kind of by accident. I got a new job and I had a few transgender folks on my caseload, and it was really a learning experience for me. I've been I just consider myself very lucky and very privileged that they helped me kind of open my eyes to what their experiences were, and I sought out a lot of extra education and training. I now have a certification as a transgender care therapist, which just means I've had more hours of training and have a little bit better understanding of a lot of the challenges faced by the transgender community. I myself am a cisgendered heterosexual female, and I consider myself an ally. I'm definitely not going to be the expert because I don't have that lived experience, so I'm not that kind of expert, but I have a lot of extra training so that when you come to see me, you're not going to have to educate me, or at least not educate me on the transgender community in general. Probably have to educate you a little bit on you because you're going to be the expert on you, but I really work to make sure that I am sufficiently knowledgeable, and yet I will always defer to you as being the expert on your experience and your community. So I thought I'd throw that in there just so you can kind of understand how I came to do this. It really resonates with my social justice values, and so I think there needs to be more of us allies out there who get the training so that we can be better allies and better mental health professionals for the transgender, gender non-conforming, non-binary, gender fluid communities out there. And so that's kind of my perspective, and I wanted to give you that little bit of insight into my practice. If you want more information, feel free to head over to my website, www.colettelordphd.com. Thanks.